um, approaches to retention. Is there a way to kind of categorize them?
There is. Based on how long and how often you need to wear a retainer, we can think of retention in three main categories: limited retention, moderate retention, and then permanent or semi-permanent retention.
Okay, let's break those down, starting with limited retention. What kind of cases would fall into that category?
Well, limited retention is for corrections that are likely to stay put, with just a little help. A good example is a corrected crossbite, where the upper and lower teeth were misaligned.
Oh, okay, so once the crossbite is fixed, the teeth are less likely to drift back.
Well, it depends. Like anterior crossbites where the front teeth are involved, those usually need retention until a good overbite develops.
Okay, what about posterior crossbites? Those are the ones in the back, right?
Hmm. Right. So for those, it depends on how the teeth are angled after the treatment. If they're angled correctly, you might not need much retention. But if the crossbite was corrected by expanding the arch, then yeah, you'll probably need longer-term retention.
Okay, that makes sense. So crossbites are one example. Any others?
Yeah. Cases that were treated with serial extraction, that's where they take out some teeth to make space for the other teeth to come in properly.
Oh, I've heard of that. But doesn't taking out teeth make things less stable?
It can, which is why you still need some retention. Research shows that, cases with second premolar extractions tend to have better long-term results than, say, first premolar extractions.
Huh. So the type of extraction matters. Interesting. Anything else?
High canine extraction cases, those usually need limited retention too. And then
Right.
sometimes they do extractions to address a specific malocclusion, like maybe to adjust the front teeth to get that ideal class I canine relationship.
Class I canine relationship.
It's the ideal position for the canines.
Got it. Okay, so those are all cases that tend to be pretty stable. What about moderate retention? When is that necessary?
So moderate retention, that's a step up. We use that when the teeth need more support as the muscles and the way your mouth functions adapts to the new positions of the teeth.
So it's like giving your mouth a little extra help to adjust to its new reality.
That's a great way to put it. A classic example is class I non-extraction cases with, protrusion and spacing.
Meaning the teeth are like sticking out too far and there are gaps between them.
Right, exactly. So retention continues until the lips and tongue are functioning normally again.
So it's not just about straightening the teeth, it's about like retraining the muscles around them too.
Exactly. And then what other case? Oh, class 1 or 2 extraction cases often require moderate retention, especially in the upper arch.
Okay.
Again, it's all about that balance between lip and tongue function and making sure those teeth stay where they're supposed to be.
Gotcha. And what else falls under moderate retention?
Oh, corrected deep overbites.
So making sure that overbite doesn't come back.
Yep. And that might involve wearing a bite plate on the retainers, sometimes even during meals.
Wow, it's amazing how much detail goes into all this.
I know, right? And let's see. Oh, if the overbite correction involved rotating the lower jaw, then they need retention until their growth catches up to, make sure that vertical dimension stays stable.
Okay, that makes sense.
Yeah.
Anything else?
Yeah, 2 more things. Early correction of rotated teeth usually needs moderate retention, and then cases with ectopic eruption or supernumerary teeth.
I'm gonna need you to break that down for me.
Sure. Ectopic eruption just means a tooth came in the wrong place, and supernumerary teeth are like extra teeth beyond the normal set.
Oh, wow. So the retention is to keep those teeth in their new corrected spots.
Exactly. And for those cases, they often use bonded retainers. They're like permanently attached to the teeth.
Makes sense. Okay, what's the last one?
Class 2, Division 2 malocclusions. It's a specific type of overbite. Those cases just need longer retention for the muscles to adapt to that new bite.
Okay, so those are all examples of moderate retention. And then you mentioned a third category, permanent or semi-permanent retention. When would you need to go that route?
Permanent or semi-permanent retention is for cases where there's a really high risk of relapse, or, when getting that perfect look without taking out teeth is really important.
So you're basically committing to wearing a retainer like forever.
Pretty much, yeah.
Yeah.
One of the most common examples is expansion cases, particularly in the lower jaw.
We talked about that earlier with the crossbites.
Right. When you expand the dental arch, it can make things unstable, so you often need permanent retention to keep everything aligned.
Okay, that makes sense. What else?
Generalized or severe spacing.
Yeah.
If you have gaps between a lot of your teeth, permanent retainers can help keep those spaces closed.
Like building a fence to keep those teeth in line?
Exactly. And then there are cases of severe rotations or labiolingual malpositions. That's where the teeth are tilted or in the wrong position.
I'm guessing those are tricky to fix.
They can be, especially in adults. So a lot of times they'll use permanent lingual bonded retainers. Those are attached to the back of the teeth.
Gotcha.
Anything else?
One more common one, spacing between the upper central incisors.
The two front teeth?
Yep. So for adults, permanent retention is often the best way to keep those spaces from opening back up.
This is a lot to take in. Is there an easy way to remember the differences between all these categories?
Sure. Think of it this way. Limited retention is for those corrections that are likely to stay put on their own, but they still need a little bit of help to stabilize.
Okay.
Moderate retention is for those corrections that need a little more support, as the muscles and everything else adapt.
Right.
And then permanent or semi-permanent retention, that's for those cases that are either really likely to relapse or when looks are really important and you don't want to take out teeth. Okay, that's really helpful. So it's not just about, the type of problem you had. It's about how your body actually adapts to the changes.
Exactly. And remember, it's not just about the teeth themselves. The muscles play a huge role too. Making sure the lips, tongue, all those muscles are balanced. That makes a big difference in the long run.
It's a whole mouth approach, not just
Right.
focusing on the teeth themselves.
You got it. And we've learned that if you correct problems early on, like rotated teeth or teeth that come in the wrong place, those often benefit from longer retention, especially in those really challenging cases, like when someone has extra teeth.
So those tricky cases need a little extra TLC.
Yeah, for sure. And then expansion treatments, those are super prone to relapse, so permanent retention is often the way to go, especially if you want to avoid taking out teeth.
Okay, so I guess the big takeaway here is that retention planning, it's not a one-size-fits-all kind of thing. It really needs to be tailored to the individual patient.
Exactly. And don't forget about those follow-up appointments. Those are crucial to make sure the retainer's doing its job. And, if something breaks, like a fixed retainer, you can catch it early.
Okay, so we've talked about all the different categories of retention planning. Now I'm kind of curious about the actual retainers themselves. What kinds are out there?
Well, there's the classic Hawley retainer. It's been around forever.
I remember those.
Yeah.
Are those still popular?
Oh, yeah, definitely. They're customizable, they last a long time, and they're, relatively affordable.
What else is out there?
There are circumferential maxillary retainers. They're really good at, providing good retention, and they don't interfere with your bite.
But I'm guessing those are a little more noticeable than the Hawley retainers?
Yeah, they can be, but they're very effective. Then you've got those clear retainers. Those are super popular these days.
Yeah, those are nice. You can't even really see them.
Exactly. And they can double as a night guard if you grind your teeth. Then there are fixed retention appliances. Those are the ones that are bonded to the back of your teeth.
Oh, right. So like a built-in insurance policy for your straight teeth.
Uh-huh. That's a good way to put it. And then there's the positioner. It's kind of a hybrid appliance. It helps maintain tooth position, but you can only wear it for a certain amount of time each day.
Wow, so there's a whole menu of options out there.
There is. And the best one for you depends on, your needs, how complicated your case was, what you prefer.
I'm sensing a theme here. Personalized care is key.
It really is. And speaking of personalization, it's important to remember that, not all dentists have the same approach to retention.
What do you mean?
I mean, what works for one person might not work for another, but most dentists, they will use some kind of retention for the lower teeth, until growth is complete.
Okay, that makes sense. And it sounds like having a good conversation with your dentist about retention is really important, even before you start treatment.
Absolutely. It's all about setting realistic expectations, understanding what you're getting into.
I'm also curious about the different phases of retention. Is it just one continuous thing?
Not really. There are usually two main phases. You have the initial healing phase that usually lasts about 12 months, and then you've got the long-term maintenance phase, which could go on indefinitely.
So that first year is all about letting things settle down and stabilize.
Yeah, pretty much. And during that time, you'll probably be wearing your retainers, most of the time.
And then the maintenance phase is all about preventing those long-term shifts.
Exactly. And you might not have to wear your retainer as often during that phase, but it's still really important.
Okay, so we've covered a lot here. We talked about all those different theories, the things that affect stability, the categories of retention planning, the types of retainers. But there's one last question I have to ask. What happens if, after all that, our teeth do shift? Is all hope lost?
No, not at all. There are definitely ways to recover from relapse.
Okay, phew. That's good to know. What can you do?
Well, sometimes it might involve, you know, rebanding or rebonding the teeth, basically kind of repeating parts of the original treatment.
So like hitting the reset button?
Sort of, yeah.
Mm,
But it's important to remember that retreatment is usually a last resort.
right, right. Better to prevent it in the first place.
Exactly. And that's why understanding retention and, being good about wearing your retainer, it's so important.
Wow, this has been a really eye-opening conversation. It's incredible how much goes into keeping teeth straight.
It is. It's pretty amazing what orthodontists can do.
All right, before we wrap up, let's recap some of the key takeaways for our listeners. So first and foremost, retention is not an afterthought.
It's definitely not
It's a crucial part of the whole orthodontic journey.
right from the beginning.
We also busted that myth about wisdom teeth always being the culprit for crowding. Turns out it's a lot more complicated than that.
And we talked about all the different categories of retention planning, from limited to moderate to permanent, and how it really depends on the individual person.
And then finally, relapse can happen, but there are things you can do to fix it.
Absolutely. The most important thing is to be proactive, stay informed, and work closely with your dentist.
Well said. So for our listeners out there who are, thinking about getting braces or maybe they're in the middle of treatment, I have a question for you. Now that you know all about retention, how do you think technology might change how we approach this whole thing in the future? It's like, imagine personalized digital retainers, you know,
Oh, yeah.
or smart appliances that can, like, track your progress and tell you if something's wrong.
Uh-huh.
Maybe even, like, bioengineered materials that help your teeth settle in
The
faster.
future of orthodontics, right. It's pretty exciting.
It is. But I
Yeah.
guess even with all that cool stuff, the basics of retention, they're not going to change.
Nope, the principles are the same. It's all about making sure those teeth stay put and your bite works the way it should, long term.
Exactly. And that's where, patient education comes in and having a good relationship with your dentist.
Couldn't agree more. The more you know, the better, especially when it comes to your health.
Well said. This has been a really fascinating deep dive. I mean, we didn't just talk about the science, but also like why it's important for everyone to be, proactive about their dental health.
Totally agree. It's been a pleasure chatting with you about all this.
And to our listeners, thanks for joining us on this orthodontic adventure. We hope you learned some stuff and feel like you can take charge of your smile journey.
Remember, a healthy smile is a beautiful smile. And retention. That's the key to keeping those pearly whites shining for years to come.
Until next time, stay curious, stay informed, and keep those smiles amazing.